And welcome in to be our guest. Last week we had Dr. Wick Many, an infectious disease specialist, and we had so much information to give to you. We're going to continue where we were last week and teach you more. Thanks for coming to listen.
The biggie, COVID. Okay. So COVID is with us, and it will probably stay with us. That is just the nature of the beast. And very similar to influenza, it is changing its genetic makeup, and that's why we hear all these different variants, and this variant, that variant, this variant. But that is expected. That is sort of to be expected with this type of virus. The kind of virus it is, it's an RNA virus, and characteristics of all RNA viruses is that they reproduce themselves very rapidly, and every time they reproduce themselves, they make a small little different change in their genetic makeup. And that's why we have to get new vaccines, because the COVID vaccine that was around a year ago is not the same, the COVID virus that's around a year ago is not the COVID virus that's here now. The variants have changed. Some of them are more infectious. Some of them cause more severe disease. Some of them cause less severe disease. But currently there will be, and has been approved, a new quote-unquote booster for the common variant that is circulating now, which will also hopefully cover the two other variants that are starting to sort of surface and causing the bump in diseases that we're seeing, the increase in hospitalizations and unfortunately the increase in death. So the age groups for COVID, anyone over 6 months of age up. Okay, so for the COVID booster, anyone 6 months or older, particularly in high-risk groups. High-risk groups, again, include 65 and over, anyone with chronic lung disease, chronic heart disease, diabetes, immunocompromised patients. All of those individuals are at a higher risk of having adverse outcomes. What about the safety of the vaccine? Everything we do in medicine has risk. Everything we do in medicine. If I give you an aspirin, there is a risk. Okay. So what is done is we approach this as what is the benefit, what is the risk? If the benefits far outweigh the risk, then you proceed, whether that be a medication, a test, an operation. Conversely, if the risk far outweigh the benefits, then we don't do it, whatever it is. So in this circumstance, the benefits, in my opinion, and in the opinion of the experts in the field, people who are really study this day in, day out, the benefits far outweigh any potential adverse effects.
Well, would you suggest there is a lot of, like you said, controversy out there. So would it be the best thing to do just to discuss that with your physician?
Discuss that with your physician, and don't go on Facebook or X or Twitter or whatever it is now, because anyone can post something on those media, those platforms. Go to the science, go to the National Institutes of Health, go to the Center for Disease Control, look at the peer-reviewed journals, New England Journal of Medicine, Annals of Internal Medicine, that all are reviewed by highly qualified scientific investigators who know what they're talking about, as opposed to someone who is on Facebook.
So would you still agree that the bottom line is that that's a decision between you and your physician?
It is everything is a decision, okay? These are what are called recommended, okay? These are not mandatory. These are recommended. Now you have to realize that, there's a lot of things that we recommend, like wearing seat belts, and people don't do them. So you have to, suffer the consequences if you decide not to wear a seat belt and you get in a car wreck. So these are recommendations, and then unfortunately, if you decide not to get the vaccine and you get COVID, well, then that was a decision you made.
Of course, you could get the vaccine and get it too. So that's not preventing you from getting COVID.
Okay.
So
one last new virus that we're talking about is respiratory syncytial virus, or RSV. Now, we've known about RSV for a long time as a most common cause of croup in children. But because now we have better tests to detect the virus, we realize that RSV is a very common cause of lower respiratory tract infections in the elderly, and causes about 6,000 to 10,000 deaths per year due to RSV in the elderly. RSV also it in itself may not cause you to be ill, but it can trigger an exacerbation of an underlying disease. It could trigger an exacerbation of your heart failure, trigger an exacerbation of your chronic obstructive lung disease. This is the first time it's been around for adults. I think this is one that you really have to talk with your physician about.
Okay.
And if you're in a high-risk group, and I say a high-risk group, particularly not only over 65, but over 75,
Okay.
and if you have chronic heart or lung disease, this is a decision that you're going to have to really have a very detailed conversation about the risk versus the benefits.
Okay. Thank you very much. I hope that we have cleared up a little bit of confusion. And still, bottom line, you want to talk to your physician and make your best judgment. And thank you for being with us, and we'll be right back.